Do you ever get TMJ joint pain, temporal mandibular joint pain? It can be a minor nuisance all the way to debilitating. In this video, I'm going to give you a comprehensive home routine that you can go through on a day-to-day basis to help get rid of your temporal mandibular joint pain in the comfort of your home. Providing you with pain relief strategies and wellness solutions for modern day living. My name is Dr. Jon Saunders. Temporal mandibular joint pain, or TMJ for short, can be debilitating. It can affect your ability to talk, to eat, and even to sleep. When the TMJ joint is not functioning properly, it can cause a host of problems. Things like clicking, grinding, locking. It can cause headaches, facial pain, tinnitus or ringing in the ear. It can even cause dizziness or vertigo due to the fact it's quite close to the inner ear. While the TMJ joint might be small, it is a complex joint. It contains an articular disc between two joint cavities. It has many muscles that attach to it to allow the joint to function when chewing or talking. In this video, I'm going to give you 3 things that you can do to help alleviate your TMJ joint pain in the comfort of your home. The first is trigger point therapy or cross friction massage. We're going to take 2 main muscles, the masseter, the muscle that you can feel when you clench, and the temporalis muscle that, again, if you clench, you can feel the muscle bulge in your temporal region. These 2 muscles are often a cause of TMJ joint pain, often due to excessive chewing, chewing gum, stress, clenching at night. So there's a few things you can do to help alleviate the tension in these 2 muscles. The first thing you're going to do, you're going to find the masseter muscle by clenching, and you're going to relax, and you're going to just search the muscle for any tender nodules or points. When you find them, you're going to apply a little bit of pressure, and just enough pressure to elicit some discomfort. If you hold them for 10 to 15 seconds, you will find that the tenderness in those trigger points will diminish. And you may have to open your mouth a little bit just to stretch out the muscle a bit, but if you search, you will find some trigger points. The same thing with the temporalis muscle. You're going to find the muscle by clenching, and you can do one side at a time, or you can do both. I can feel some right there. Again, apply a little bit of pressure just to elicit some discomfort. And at the same time, you can slowly open your jaw. You will feel that muscle move under your fingers. Finally, for these muscles, you can do some gentle cross-friction massage, up and down, back and forth for both of these muscles. Up and down, back and forth. And what you want to make sure is that you're not going over the skin, but you're actually bringing the skin with you. Number 2, isometric exercises. 2 of my favorite isometric contractions involve using the palm of your hand on the side of your jaw. What you're going to do, you're going to slightly open your mouth, keep your teeth aligned above and below so that you're not one side or the other. And all you're going to do is put a little bit of pressure and resist that muscle on both sides. These isometric exercises should be done 3 to 5 times on each side with a hold between 5 and 10 seconds. Another one is you're going to make sure that your hands are clean. Basically, we're going to take our hand and we're going to put it either on our teeth or just inside our jaw very gently, and we're going to pull down and we're going to resist that movement. You're going to be very gentle. You're going to resist the movement while you're pulling down. There will be no movement in the joint, but you'll activate muscles to help strengthen the jaw. Finally, the third thing you can do to help your TMJ joint at home is stretch it. Very simply, we're going to stretch from side to side. Again, we're going to use the same palm, and we're going to do this very gently. We're going to open our mouth slightly and stretch. Both sides. You should feel a nice deep stretch. Again, not too hard. It is a sensitive joint. If you overdo it, it'll be a little bit tender. Another one I really like is from the front, and it's very simple. We're going to take our 2 or 3 fingers and we're going to just open slightly, keep your teeth over top of one another, the top and the bottom, and we're going to just slightly push back into. Hold it for 10 seconds, 3 to 5 times per day. I will say when you're doing these exercises, make sure your posture is good because your posture influences the alignment of your upper neck, which influences the alignment of your TMJ joint. Again, so from the side, open slightly. Holding for 10 seconds, 3 to 5 times a day. After doing this routine for a few weeks, you should start to notice your jaw getting stronger, the pain reducing, and your range of motion improving as well. If your problem persists, this is where it might be appropriate to seek out a chiropractor that can also take a more closer look at your TMJ joint. Oftentimes, treatment of the upper neck and the TMJ joint will be necessary to help alleviate your TMJ joint problem or pain. Please give the video a thumbs up if you liked it. If you like content like this, I'd appreciate it if you subscribe to our channel so you can be notified of future videos when we upload them. For more help with your TMJ joint problem, click the video here. This is a few stretches of your upper cervical spine or neck that might just help alleviate some of your TMJ joint problems as well. Thank you for watching, and I'll see you on my next video.